650 million to 1.28 billion in last 30 years. That's a meteoric rise in the hypertension cases worldwide as per WHO. An estimated 46% of adults with hypertension are unaware that they have the condition, and less than half of the adults, that is only 42% with hypertension, are diagnosed and treated. In India, about 33% urban and 25% rurals are suffering from hypertension or high blood pressure. Talking about the market for blood pressure related OTC products, 26.8 billion US dollars was the blood pressure management supplement market back in 2022 and is anticipated to reach 41.8 billion USD by 2033. Every day a new supplement and a new recipe pops up on the social media claiming to treat blood pressure with no scientific proof. In this series, we will be clinically and scientifically investigating each and every dietary supplement under the lens of clinical trials. The main focus for today's talk will be flax seeds, commonly known as ALSI in Hindi, and is claimed to help treat and cure blood pressure, and is now on our radar. I am Amit Deshpande and you are with Medical Mysteries. In a few moments from now, I will present you a scientific evaluation to understand if flax seeds or ALSI is good or bad for your hypertension or high blood pressure. So stay tuned and watch till the end. Flax seeds, scientifically Linum usitatissimum, is a food and a fiber crop. Flax seeds are good source of dietary fiber and omega-3 fatty acids, including alpha-linoleic acid. They also contain phytoestrogens, also called as lignans, which are similar to hormone estrogen. Flax seeds are claimed to improve many disease conditions from cholesterol to cancer. But for today, let's focus on what scientific community has to share about flax seeds and hypertension or high blood pressure. 2011, Cardiovascular Research Division, Cuba. Scientists were trying to determine whether the consumption of a diet rich in flax seeds over a period of 1 year has any beneficial effects on cardiovascular patients with peripheral arterial disease. They launched a clinical trial named FLAX PAD study, the FLAX PAD study. FLAX stands for flax seeds and PAD stands for the peripheral arterial disease. This was a single-center, prospective, double-blinded, randomized, controlled clinical trial with 110 patients over 40 years old and with peripheral arterial diseases who participated in this trial. These patients were given 30 grams of milled flax seeds or placebo, that means no treatment, per day. In these patients, occurrence of myocardial infarction and stroke was observed for a period of 1 year. Apart from this, cardiopulmonary performance, cardiac arrhythmias, serum lipid profile, arterial sufficiency, blood pressure, inflammatory profile, and platelet functions were also monitored. While this trial was going on, in 2014, St. Boniface Hospital and Research Center in Canada launched one more clinical trial, and this trial was named as the HyperFlax trial. In the previous FlaxPad trial, patients were hypertensive and receiving medications. But in this HyperFlax trial, patients were newly diagnosed and were not receiving any medications. This trial was a parallel superiority phase 2, phase 3 randomized double-blind and controlled clinical trial with 100 participants newly diagnosed with stage 1 hypertension who have not yet administered with antihypertensive medications participated. Participants were randomly allocated with a 1:1 ratio into a flaxseed or control group and provided food products to consume daily for 6 months. The research outcome of these 3 clinical trials on the effect of flax seeds and hypertension led to 3 major reports titled The Effect of Dietary Flax Seeds on Improving Symptoms of Cardiovascular Disease in Patients with Peripheral Artery Disease, Rationale and Design of FlaxPad Randomized Controlled Trial. The next one was the HyperFlax trial for determining the antihypertensive effects of dietary flax seeds in newly diagnosed stage 1 hypertensive patients. Study protocol for a randomized double-blind controlled clinical trial. And the third one, potent antihypertensive action of dietary flax seeds in hypertensive patients. Before going into the results of clinical trial, let's just brush up the few basics about blood pressure. So when we say systolic blood pressure, that means the pressure in your arteries when your heart beats. And when we say diastolic blood pressure, it means the pressure in your arteries when your heart rest between the beats. A normal blood pressure level is less than 120 by 80 mmHg. Some healthcare professionals diagnose patients with high blood pressure if their blood pressure is consistently 140 by 90 mmHg or higher. That is according to the 2003 guideline. Other healthcare professionals diagnose patients with high blood pressure if their blood pressure is consistently 130 by 80 mmHg or higher. And that's the 2017 guideline. So now let's have a look on the results from these trials and what they say about the flaxseed and blood pressure connection. The summary for all these clinical trials and publications summarize that patients who consumed flax seeds had their systolic blood pressure 10 mmHg lower and their diastolic blood pressure 7 mmHg lower as compared to patients who did not consume flax seeds. Patients who started the trial with systolic blood pressure of 140 or more than 140, their systolic blood pressure showed a significant reduction of 15 mmHg and diastolic blood pressure reduced by 7 mmHg when they consumed flax seeds for 6 months. So these three trials very well confirm that 30 gram flax seeds consumption for 6 months has the power to control your blood pressure. If you're already diagnosed with hypertension but not taking any medications, then definitely you can start flaxseed supplements. And if you are taking medications, in that case as well, you can start flax seeds. But in any condition, please do not try to adjust your current hypertensive drug therapy dose without consulting your physician. So that brings us to the end of today's talk. Coming up is a delicious chia seed muffin recipe. So don't miss that part. For more health related information strongly backed with scientific proof, please subscribe this channel. Thanks for watching and have a great day ahead. Thank you.